Hello and welcome to myTRIAList. Today we'd like to provide an overview of the JADE clinical trial. This study is exploring a new treatment option for patients with PD-L1 positive, locally advanced head and neck squamous cell carcinoma that hasn't been surgically removed and who have completed chemotherapy and radiation therapy.
Could you explain what head and neck squamous cell carcinoma is?
Head and neck squamous cell carcinoma, or HNSCC, is a type of cancer that starts in the squamous cells, which are the flat cells lining the surfaces of the head and neck. It can affect different parts of the mouth, throat, voice box, and nasal passages. HNSCC starts when a normal cell starts to multiply. These copies form a tumor that can harm tissue and spread throughout your body.
What does locally advanced mean?
When we say locally advanced, it means the cancer has grown outside its original location but hasn't spread to other parts of the body.
My name is Dr. Deborah Wong. I'm a medical oncologist and I treat patients with head and neck cancer. Patients who have locally advanced squamous cell cancers of the head and neck, that is cancer that has started in the head and neck area and spread to the lymph nodes, oftentimes are treated with a combination of chemotherapy and radiation, which is a very intensive treatment course. Despite this intensive treatment, up to half of patients may relapse, meaning the cancer comes back even despite chemoradiation. And as of right now, in such patients, we don't have any additional treatments that have been proven to decrease the chance of recurrence. And so this JADE study is important because patients are randomized to receive the anti-PD-1 immunotherapy dostarlimab after chemoradiation in order to see if adding dostarlimab helps prevent cancer recurrence.
What does it mean for a cancer to be PD-L1 positive?
PD-L1 positive means the cancer cells have high amounts of the PD-L1 protein on their surface. When cancer cells have high amounts of PD-L1, it puts the brakes on the immune system and stops the immune cells from killing the cancer. Cancers that are PD-L1 positive may benefit from treatment with specific immunotherapy medicines.
What is the medicine being studied in this trial?
Dostarlimab is an immunotherapy medicine. Immunotherapies boost your body's natural defenses against cancer. Dostarlimab works by blocking the protein on cancer cells that allows these cells to hide from your immune system. Dostarlimab blocks PD-1, which normally stops immune cells called T cells from attacking the cancer cells. By blocking PD-1, dostarlimab removes the brakes so T cells can find and attack the cancer.
What is the goal of this study?
The goal of this study is to look at how well and how safely dostarlimab works compared to a placebo after chemoradiation in patients with locally advanced HNSCC. A placebo is a substance that looks like medicine but doesn't have any active ingredients. Studies show that starting immunotherapy soon after chemotherapy and radiation might be helpful.
Can you tell me how this study is set up?
This is a randomized study, meaning that participants will be randomly assigned to one of two groups. One group will receive dostarlimab, an investigational medicine that has not been approved for HNSCC. The other group will receive a placebo, which is equivalent to standard of care therapy.
So one added benefit of participating in a clinical trial like the JADE trial is it allows you to stay closely connected to your team because you're coming in more frequently for follow-ups, for checkups, for treatment, for lab work, for imaging. And so in that way, patients continue to feel supported as they continue in their cancer treatment journey.
Who can take part in this study?
To join, you must have a new diagnosis of HNSCC that hasn't been surgically removed. This includes a diagnosis of HNSCC specifically in the mouth, throat, or voice box. You must have plans to complete cisplatin and radiation therapy. You must have a PD-L1 positive tumor status. You must also be at least 18 years old to participate. There are additional eligibility criteria to participate. For a complete list of eligibility criteria, please visit the JADE study page on myTRIAList or clinicaltrials.gov and search for the trial using the ID NCT 06256588. We hope this video helped you learn more about the JADE study. Check out the JADE study page on myTRIAList, where you can find the study contact in case you have questions or want to find out if you qualify for the study. Visit the myTRIAList trial finder at mytrialist.org to find the right study for you.